So let's talk about your thyroid and what your doctor may not be telling you or testing for and related to your thyroid health. So your thyroid gland, this is a very important gland. A lot of people have heard about it. You may or may not know a lot about it, but I'm hoping to break down a lot of things and tell you how we approach things and how that might be different than your doctor and how we look at a more comprehensive picture. So the thyroid gland is what's called an endocrine gland. We have many endocrine glands in our body. Endocrine glands are glands that produce hormones. So the thyroid gland sits in the neck area right about here. It's a small butterfly-shaped gland, and it has critical functions for our body. So the main one that people know about, and really the main role of the thyroid, is managing the metabolism. So controlling your metabolism, how fast or slow we're using up fuel for energy. So that can affect obviously your energy levels, brain function, but also as you're creating energy in the body, using energy, that's going to create heat. So this is also related to heat. And then because this is managing metabolism in the whole body, it's affecting many, many other things in every cell of our body. So it is critical to keep the thyroid functioning well. And unfortunately in today's world, more and more people are having issues or symptoms of thyroid imbalance. So I want to talk about that. Some of these symptoms, number one would be like excessive weight gain that's abnormal to you and what your diet and lifestyle is, or you're just having a harder time losing weight. Again, that would be different than is typical for you. Also lowered energy, brain fog, hard to get going in the morning, being a slow mover. Also things related to the skin and the hair. So dry skin, dry, brittle hair, brittle nails. Also hair falling out can be a sign if that's been increasing and that's abnormal. Also the outer third portion of the eyebrows, if those start to fall out and start to lose them, that's kind of a classic sign of hypothyroid or underfunctioning thyroid. There's many other things, you know, it plays a role in growth and development and different things, but that's some of the main things that you would notice. So typically, I want to talk about how a doctor would typically approach this, and then also me as a holistic functional practitioner and in our clinic, how we approach this, how we look at it, how we look at a more comprehensive thing, and it's not a one-size-fits-all situation. So I'm going to kind of break this down. I'm going to get into some details for those of you that like that, kind of break this down a little bit more so that you can kind of understand, but in a way that you can hopefully, grasp very easily. So your doctor, most medical doctors, they're trained that if you have signs of underfunctioning thyroid or you're curious about that, the first thing they're going to typically do is test TSH. So this stands for thyroid stimulating hormone. So to kind of understand how this all works, thyroid stimulating hormone is where this starts. So it's produced in actually the pituitary gland. So your pituitary gland sits in your head. It's considered one of your master glands because it's basically controlling and telling a lot of the other glands what to do. And that's the case in this situation. So it's producing TSH, thyroid stimulating hormone. It's stimulating and telling the thyroid how much or how little thyroid hormone to produce. So the thought process goes, there's a general range you want for TSH. And if that number starts getting too high, it's a sign of underfunctioning thyroid. Because if the thyroid isn't producing enough hormone, TSH, the body's smart, it's going to start signaling more and more and more and more. It's going to produce more and more TSH, telling, hey, you're not producing enough thyroid hormone. We need to ramp up production. And that number will continue to go up and up and up and up. So, and a lot of times that's where most doctors will stop. So if you're in the quote unquote normal range, then they say your thyroid is fine, you know, according to them, and they won't dig any deeper, typically. If it's abnormal, a lot of times they'll then run another test checking either T4 or T3. So to kind of break this down further, so again, you kind of understand at this point, TSH, produced by the pituitary, it signals the thyroid. So then the next role is by the thyroid actually producing the main hormone it produces, which is T4. But T4, you have to understand, isn't the real usable form of the hormone. So T4 gets produced, total T4, if you will, and then a portion of total T4 is in free form, so-called free T4. Pretty simple here. But free T4 is in the free-flowing form. It's the more bioavailable form. So only a small portion of total T4 is in free form. And then the body has to convert free T4 to free T3. And so kind of at the end of this whole process, one of the main goals is to get to free T3 because that free T3 is the usable form of that hormone by the body and what the body uses and you feel in terms of energy, metabolism, heat production, all the things we want from our thyroid. So back to your medical doctor. So if TSH was high, they run, and then maybe, the typical one would be like they're going to run total T3, for example. And then as long as, again, those look fine, that's it. Or if total T3 is low, or sometimes they'll do total T4. If those are low, then they'll probably put you on a thyroid medication. And the main medication they use is levothyroxine, which is a type of T4. So, where a little bit of this breakdown starts to happen is don't understand that how the body converts T4 to T3 and that relationship. So we're not only looking at all the numbers, but we're looking at the relationship between them. And you should be converting a certain percentage of that free T4 to free T3. And if that conversion is sluggish, then that can majorly affect your free T3 levels. So basically I've had, what I would say is the majority of people that come to me with thyroid issues, or the doctor told them they had a thyroid issue, or they were put on medication for a thyroid issue, didn't actually have a thyroid problem. They actually had a conversion problem. So most people's thyroids are functioning, okay. They might be a little sluggish, but still functioning enough. But really the breakdown happens when the T4 gets converted to T3 and it's not converting over efficiently. Most of that conversion happens with our liver. Our liver does the majority, the bulk of that conversion. But then secondarily in our gut, a lot happens in the gut with that conversion. And then a small portion happens in our peripheral tissues, muscle tissue, different stuff like that. So if, let's say, your doctor's only looking at TSH and total T4, that might look okay. And again, but you might actually have another problem. Or conversely, if they're looking at if they're looking at T3 and saying it's low, and then they're putting you on a medication, you may or may not actually need that medication because you might be producing, your thyroid might be producing the proper amount of T4, it's just not converting it properly. So, what I do and what we do at our clinic is we always test everybody's thyroid comprehensively. So we test for TSH, we test for total T4, free T4, total T3, free T3. But then we also throw some additional ones in here to get the full picture. Reverse T3, T3 uptake, and the thyroid antibodies. So there are antibodies that your immune system can produce that can cause the body to attack the thyroid. So the two main antibodies that we look for, the two main ones that we see in people, TG, thyroglobulin, and TPO, thyroid peroxidase. So when these enzymes, or when these, not enzymes, when these antibodies are elevated, that's a sign that the body is having an immune response and it's actually attacking the thyroid. So another thing to mention this is you may have normal functioning thyroid levels as far as TSH, T4, T3, all of that, but you could have elevated thyroid antibodies. It might be early stage, subclinical, where the body is attacking the thyroid, but it's not been doing it long enough or at a high enough level to cause damage enough on the thyroid that it's actually messing up the production. So again, when we test, we're actually looking at that, and if everything's fine except for those antibodies, we're able to do something about that before it turns into a more serious problem. So again, this is something that medical doctors miss quite often. Conversely, you can have you can have different combinations of this as you see, high antibodies, low antibodies, high, low, different levels. So everybody's situation is individual and unique. And that's really the part of looking at the comprehensive picture to see where in the chain is the breakdown. And yeah, occasionally some people come to us and actually truly have a thyroid problem. But most, again, 80 to 90% actually just have a conversion problem. They don't need to be on a thyroid hormone. They don't need any of that. They just need to work on other things to get that conversion happening properly. But again, we also look at reverse T3. So reverse T3 can get out of balance and can go too high, can be a problem when we have excess inflammation, when we have infection, when we have excess toxicity, especially heavy metals and other toxins, can cause reverse T3 to go too high, which can basically inactivate some of our usable thyroid hormones. And then lastly, T3 uptake. So T3 uptake is important, and when that's out of balance or it's too low, a lot of times we're missing some micronutrients that are important, selenium, iodine, some other things, and that can affect this whole picture. So again, we like to look at the whole picture and see exactly where the breakdown is so that we can specifically address that with each individual, and that's extremely important because again, so many people come to me diagnosed incorrectly or put on a medication they didn't need to be on that then is potentially causing other issues. And so we've worked with countless people on helping see where the breakdown is, reversing, getting things back in order, even people with elevated antibodies. I know a lot of times the doctors will tell you, okay, once you have Hashimoto's, an autoimmune thyroid condition, you're gonna have that for the rest of your life. And we just don't believe that. We know that your body can heal itself. We know that God's a healer. And we know if we do the right things, we can get the body back into balance. So there's a lot of reasons that could be happening. And we've seen many people come back into the normal range and stay there for years and years and years. So that's a lot of information related to thyroid. I hope you enjoyed. If you liked it, make sure to like this video, subscribe. We're going to constantly be putting out more and more information about health to keep you updated with how we approach things, all the new things that we're learning. So I hope that you enjoyed this.